Welcome to Workforce Wednesday from General Practice Solutions. This week, I would like to focus on one of the most significant and widely discussed challenges currently facing general practice: balancing digital access with traditional patient contact. Over recent years, primary care has seen a substantial shift towards digital services, with practices increasingly adopting online consultation platforms, digital triage systems, online registration forms, electronic prescription requests, and secure messaging services. These developments have undoubtedly improved accessibility for many patients, but they have also fundamentally changed the workload and responsibilities of administrative teams. For many years, the majority of patient contact came through telephone calls or face-to-face inquiries at reception. Today, practices are managing patient requests across multiple channels simultaneously. A single administrative team may be answering calls, responding to online consultation submissions, processing emails, reviewing electronic documents, managing patient registrations, monitoring digital messaging platforms, and supporting clinicians with workflow, all within the same working day. Rather than replacing traditional methods of communication, digital services have expanded the number of ways patients can access their practice, creating an entirely new layer of administrative demand. The challenge is no longer simply answering the telephone or responding to patients at the reception desk. Every digital request still requires administrative input. Online consultation forms must be reviewed, categorized, and directed to the appropriate clinician or service. Patient registration forms require verification before records can be created. Digital prescription requests must be processed in line with practice procedures, while electronic correspondence must still be reviewed, coded, and actioned appropriately. Although technology has changed how requests are received, it has not removed the need for skilled administrative professionals to manage them safely and efficiently. This creates an increasingly complex working environment. Administrative teams are expected to move seamlessly between multiple systems while maintaining accuracy, confidentiality, and excellent patient service. Staff may begin the morning managing telephony demand before switching to workflow processing, reviewing online consultation requests, responding to patient messages, and handling incoming clinical correspondence. Constantly changing between systems and responsibilities requires high levels of concentration and organization, particularly during periods of increased demand. One of the biggest workforce challenges is ensuring that no communication channel is overlooked. Patients expect the same level of service whether they choose to contact the practice by telephone, through an online consultation platform, or by submitting an electronic request. Practices therefore need robust processes that ensure every inquiry is managed consistently and within appropriate timescales. When workload exceeds available capacity, maintaining this consistency becomes increasingly difficult. There is also an important workforce well-being consideration. Administrative teams often report that digital transformation has not necessarily reduced workload, but has redistributed and expanded it. While some telephone demand has shifted online, practices are now managing multiple communication channels simultaneously. This means staff are required to monitor several systems throughout the day, respond to different types of requests, and continually prioritize competing demands. Without sufficient administrative support, this can contribute to increased pressure, fatigue, and a reactive approach to workload management. The increasing complexity of patient access also requires practices to remain flexible. Demand can fluctuate significantly throughout the day, with online consultation submissions, telephone call peaks, and document volumes all varying independently. Maintaining service standards across every channel requires not only clear operational processes, but also sufficient workforce capacity to respond when demand increases unexpectedly. General Practice Solutions supports practices by providing experienced associates across telephony, workflow management, document processing, clinical coding, and wider administrative services. Our associates understand the operational demands of modern primary care and are experienced in working across multiple systems while maintaining accuracy, efficiency, and professionalism. By providing reliable additional capacity, we help practices manage increasing patient demand without compromising service quality or placing unnecessary pressure on internal teams. Whether supporting telephony during peak periods, processing workflow and clinical correspondence, managing administrative tasks, or helping practices maintain operational continuity, our associates integrate quickly into established processes and provide immediate value. This enables practices to continue delivering accessible, responsive, and high-quality services while protecting the well-being of their workforce. As digital access continues to evolve across primary care, having flexible administrative support will become increasingly important. Practices that are able to adapt successfully while maintaining consistent patient experience will be best placed to meet both current and future demand. If your practice would like to explore how general practice solutions can support telephony, workflow, clinical coding, or wider administrative services, you are welcome to contact us on 0208 865 1942 or via email at inquiries@generalpracticesolutions.net. Thank you for listening to Workforce Wednesday. We look forward to having you join us again next week.